Outlined in the Growth and Social Protection Strategy is government's belief that poverty reduction can only be achieved through the growth and improvement of all contributing sectors. According to that plan, the development of health conditions that will enable current and future households to achieve and maintain a sustainable and fulfilling life is critical. Hence, the numerous strategic and very costly endeavors undertaken in the healthcare sector throughout the past 15 years and more recently in the past 2014-2015 financial year. Government's economic and social review for that period highlights those achievements. The island's primary healthcare system is its pride and joy. In the past financial year, reports are that the system's health education programs have been sustained in all health districts. Additionally, patients are able to be screened and examined at health centers. They can also access clinical services, surgical and eye care, antenatal and audiology services at negligible rates. The dental services offered at the primary level are not, however, negligible. For the year under review, more than 11,000 were seen and treated at the dental unit. A dental health services manual was launched in 2014 to guide dental practitioners. Plans for the island's health centers in the near future include roof repair and storm drain construction for the Roseau Health Center and the renovation and fencing of the Bagatelle, Newtown and Dodan Health Centers. Government will also install water tanks for all health centers in the Roseau district to serve as a backup water supply. A new Coliho Health Center is planned on the site of the existing one, while a new location for the Vickers Health Center has been identified. Plans for the Margaret Hospital are progressing. The steering committee has been established and has met. The project is estimated at $1 million. A steering committee for the Portsmouth Reginald Fitzroy Armour Hospital is also in place. Discussions with Ross University are ongoing. The pillar of any good healthcare system is competent human resource. Through government efforts, training opportunities are constantly being secured for local experts. Several newly specialized doctors have returned to work in the fields of psychiatry, internal medicine, orthopedic surgery, pathology, infectious epidemiology, radiography, and cytotechnology. 15 new nurses have joined the service, and 13 were under review at the end of the reporting period. 29 other Ministry of Health officials have also been trained in quality management. The Social and Economic Review reports a reduction in infant mortality. This is due in part to a program funded by the European Development Fund for just that purpose. That program has also seen to the enhancement of the maternal and the neonatal units of the Princess Margaret Hospital. Government has joined forces with several countries for the advancement of the local health sector. The Cuban government facilitated the services of a facial-maxillary surgeon. The People's Republic of China donated equipment valued at $400,000, which include nebulizers, digital portable ultrasound scanners, fetal monitors, and a mobile X-ray machine. The Chinese ophthalmology surgical mission performed 88 cataract surgeries free of charge and also donated important eye equipment in that period. The government's partnership with the United States yielded free surgical procedures for 7 Dominican children costing over US $800,000 and 41 other surgeries performed in St. Vincent. 4 more children are expected to receive surgery in 2015. 120 health professionals have been trained in a trauma management workshop facilitated by 2 US-based Dominican specialists. A US-based company, Topcon, also donated an optical coherence tomography machine to Dominica. In HIV/AIDS care, by the end of 2014, over 80 patients were being cared for at no cost to them at the Infectious Disease Clinic for HIV/AIDS treatment. Government foots the bill for their treatment. The 2014-2015 Social and Economic Review also reports that the National Infection Prevention and Control Committee has replaced the dated PMH Infection Control Committee. Meanwhile, an infection control and prevention performance assessment tool was tested at the Princess Margaret Hospital. Results indicate a high level of compliance with infection control guidelines among staff. That tool will be rolled out in the health districts. In that period, the National Infection Prevention and Control Manual was developed and launched. 40 derelict vehicles and over 61,000 tons of white goods and electronic waste was safely trashed by the Solid Waste Management Corporation. Meanwhile, a document outlining the national guidelines for the collection, storage, and disposal of solid waste is currently in draft form. The Environmental Health Department has been busy this past financial year. The unit conducted 38 food handler trainings across the island, making sure to reach each district. All of this has been accomplished while fighting on many levels the chikungunya virus, which severely incapacitated the workforce last year. Work on the new Princess Margaret Hospital will begin in this financial year. The project will be funded with help from the government of the People's Republic of China. That support is to the tune of $40 million. The Ministry of Health is meanwhile doing its best to guarantee that the current structures are functional and secure and that a high quality of health care is maintained. During the 2014-2015 fiscal year, the Health Ministry began executing several small-scale projects, including the repair of the PMH medical lab floor, the renovation and creation of an isolation unit, and the repair of the roof of the Central Medical Stores building, all of which is costing government $500,000. In the meantime, government has been working to adequately equip the hospital to meet the needs of the population. So far, a surgical tower laparoscope for detailed and clear endoscopy has been procured at a cost of $1 million, and a laboratory hematology analyzer for critical blood tests at $80,000. Diagnostic equipment has also been purchased: a CT scan, a digital mammogram, and a gastroscopy system. For the period, almost 2,000 people have required and accessed those services. The Labour Party government has maintained that a new hospital with new equipment and competent staff does not lack quality management and service. This is why medical professionals are being trained and the bills for their specialization footed by government. A patient safety committee has been mandated to monitor staff for conformance to procedure and safety guidelines. For GIS News, I'm Jarna Hector.